Sepsis is not just an infection, it is a race against time. And today, I am going to update about surviving sepsis guidelines that can literally decide whether your patient lives or dies. Let me break this down into simple practical way. First, sepsis is a clinical diagnosis. So don't wait for fancy test. Use your judgment. Use scoring systems like NEWS or MUSE, not QSOFA. And remember, blood cultures should be taken before the antibiotics, but never delay the treatment. Now comes the most critical part, the golden hour. If it is septic shock or even probable sepsis, antibiotics must be started within 1 hour. Next, resuscitation. Measure the lactate early. Give 30 ml per kilogram crystalloids within 3 hours. And here is a key update. Prefer balanced crystalloids like ringer lactate over normal saline. If hypotension persists, start vasopressors early, even peripherally, and your target level is mean arterial pressure more than or equal to 65 mm mercury. Now let us talk about vasopressors. Norepinephrine is the first line. If needed, add vasopressin. Still not enough, add epinephrine. Avoid terlipressin. What about fluids? Avoid starch, avoid gelatin, and don't routinely use albumin. And never forget source control within 6 to 12 hours, because no antibiotic can fix an uncontrolled source. Finally, ICU care matters. Oxygen target saturation SpO2 is 92 to 96%. Start steroids in shock if needed. Early enteral feeding within 72 hours. Control glucose if it is more than 180. And most importantly, discuss goals of care early. We have one simple way to remember everything, that is buffalo. So if you remember this one word, you will never miss sepsis management. So B stands for blood culture. You have to do within 1 hour of arrival. That is very important. Before antibiotics, you have to do blood culture. U stands for urine output. Start monitoring the urine output immediately. It tells you the perfusion, kidney function, the responsiveness. F stands for fluids. Give 30 ml per kilogram crystalloids within 3 hours. Prefer balanced crystalloids. A stands for antibiotic. This is the most critical step. You have to give broad spectrum antibiotic within 1 hour. L stands for lactate. Check it early. Repeat if it is elevated. This tells you how severe the sepsis is. And the last letter is O, oxygen. Oxygen, maintain the saturation between 92 to 96%. Prevent hypoxia, it will protect the organs. So what is the message? Remember, buffalo, act within 1 hour. Save lives, share this information with all, because in sepsis, every minute matters.